Director of the My name is Claudette Graham. I'm the Director of Education at the West Indian Social Club of Hartford. And I'd just like to thank you for joining us again as Wiscoh, West Indian Social Club of Hartford, and Wheeler Clinic continue to collaborate in a series of topics about mental health and wellness. Tonight's topic is anxiety and depression. Some Zoom rules before we continue. Please mute your phones if you're not speaking. And please raise your hands or unmute your digital hand or unmute your phone if you have questions during the Q&A. Tonight's moderator is none other than Dr. Gary Rule. Dr. Gary Rule is an MD, MPH. He's co-chair of the Jamaican Diaspora Northeast. He's an internal medicine physician and a public health practitioner. He's also a former commissioner for the city of Hartford. Dr. Rule is also an author. He wrote a book, Sailing on Broken Pieces, and it's about his brother who suffered from mental illness. Ladies and gentlemen, please join me in welcoming our moderator for tonight, Dr. Gary Rule.
And thank you, Claudette, and welcome everyone. I am Gary Rule. I have the distinct honor to introduce to you tonight a remarkable speaker, lots of knowledge, Melissa Alvarado, LMFT, is the Director of Behavioral Health Access Team at the Wheeler Clinic. And so Ms. Alvarado is the Director of Behavioral Health Access Team at Wheeler Clinic. She began her career at Wheeler as a children's and adolescent outpatient clinician, working closely with clients with trauma, anxiety, and depression. As time progressed, she moved from the community work to the residential world, serving as program manager, working with acute youth and families involved with the juvenile justice system, as well as the Department for Children and Families. Now she oversees all intake and triage services across the Wheeler Clinic's health and wellness centers. And it is exciting to work closely on implementing, this is for Ms. Alvarado, implementing such an important work is connecting community members to much needed services, helping to support local communities as always, and has always had a passion in developing ideas to support the most at-risk community members at the heart of the work at Wheeler. So a dynamic speaker. Before she starts speaking, I want to remind you that, of course, I'm glad that you joined, but as with the prior sessions, remember that we will have a raffle at the very end. It will be based on a question that I'll ask based on some of the content that she's presented. So of course, I know you're gonna listen closely. And then the way it works is I'll ask a question, and the first person who can drop the answer in the chat will win that prize. The previous ones are $25. Again, tonight it's a $25 gift card that you can use. So again, thanks for joining and welcome, Ms. Alvarado. Melissa?
Thanks so much for that great introduction. I really appreciate it, Dr. Rule. I just want to say thank you so much for having me, West Indian Social Club, and for putting on this really important mental health series. The work that you're doing is amazing. So I'm just glad to be a part and glad to be invited to share with you all tonight. So I'm actually going to take myself off camera. So as I have a nasty habit of watching myself on camera. So we're going to just minimize that. But we're going to get right into talking about depression and anxiety. Dr. Rule did a great job of the introduction, so we're just going to skip over this part, but my name is Melissa Alvarado. I am a director at the Behavioral Health Access Team at Wheeler Clinic, and so we're very excited to be partnering with West Indian Social Club and trying to make sure that we are getting the word out about the services that we have that can support our community members. And really at the heart of what we're doing is trying to get people services for mental health, behavioral health, substance use, primary care. And so we'll talk a little bit about that throughout this talk tonight. When talking about our goals and objectives for this evening, we're going to be talking a little bit more about the definitions of clinical anxiety and clinical depression, some of the signs and symptoms, and hope that you walk away understanding some of the treatments that are available. Just like to remind you that this is not an end-all be-all discussion. This is kind of a starting point for you for having a better understanding and more in-depth understanding of anxiety and depression. But the conversation always continues outside of here. And anyone, if they are interested in hearing more information or have specific questions, are very much welcome to reach out to me. And if you don't have my information, I'm sure you can get it from Chev or any of the people over at West Indian Social Club. Okay, so when we're talking about health in general, I like to kind of start with this because we're not talking just about the absence of disease, right? We're talking about like a complete physical, mental, social well-being. And to talk about mental health, we have to look at all of the factors that impact our health and affect health outcomes in general. So what you're seeing here is kind of a chart about what are some of the things that impact our overall health. It should be no surprise that social and economic factors have one of the highest impacts on our overall health outcomes, so our education, employment, income, community safety, family, and social support. Certainly, of course, what we think of as typical healthy behaviors make up about 30% of overall health outcomes. So kind of the absence of alcohol or drug use or tobacco use, the absence of risky sexual behaviors, and making sure that we are encouraging and engaging in healthy diet and exercise. I think that's the most typical thing when we think of overall health. But we also have to take into account our physical environment. That's something really important that we have to take into account: the air we breathe, the quality of water that we have, the housing and transit that we are constantly surrounded by. And then, of course, we're talking about more specifically this evening, clinical care that makes up about 20% of overall health outcomes. So that we're talking about access to care and quality of care. What we know, especially for Connecticut and Hartford especially, is that despite being one of the wealthiest states, we are ranked very high in overall health outcomes. But what is really disappointing is that we are ranked really low in overall health disparities, which basically means we have a very challenging healthcare system, and it is not equitable to all of our community members, especially in Connecticut, especially in Hartford. So one of the things that Wheeler is aiming to do is to increase that access to care and quality care at Wheeler Clinic. Before going actually into anxiety, I did want to mention, I can't see anyone now that I kind of took myself off camera, but before we get into these topics, it can be quite heavy. So if you or a loved one is struggling with anxiety or depression, just kind of remember that this is not the whole picture, right? It's a slice of the pie. It's something that, these sessions are aiming to bring awareness to the community, talk about ways to access support, to access services. So if you are thinking right now in your head, either yourself or someone that is struggling with anxiety or depression, please know that this is just a piece of the puzzle, and that's why we're trying to do this, to kind of give awareness and give access to some things that maybe could help or could be a support for you. Feel free to either throw a reaction out there, raise a hand, put a little heart emoji, or throw into the chat if you know someone that struggles with anxiety or depression. I'm sure many of us know someone, or we ourselves have struggled with anxiety. In this, we're going to be talking about what is clinical anxiety, and we'll go a little bit into the differences as well as we go on. When we're talking about, in the mental health field, anxiety, we're talking about excessive anxiety and worry. So something that is occurring more days than not for at least 6 months. So this is something that typically an individual finds really difficult to control. no matter what someone says to them, what kind of positive memes they're sent, even what kind of good things happen in their life, it is something that is so difficult to control, in fact, that many times it can actually cause distress or impairment in their social functionings, right, in their relationships, at their workplace, or any other kind of important areas of functioning. So the anxiety, when we look at it from a clinical standpoint, is a little bit more than I'm just a little bit stressed or I'm just a little bit anxious. There's varying types of anxieties that we know about. We do have a general anxiety disorder when we're looking at kind of someone coming in and expressing some of their anxiety, but there's also more specific anxieties. Some of you may have heard of social anxiety, a fear of talking in public, or a fear of being in a public space, a fear of being judged. These are some of the things that could be encapsulated in a social related anxiety where it's specific to social events. I'm sure many of you have heard of OCD. That's a term that I think gets thrown around a little bit more loosely these days. But when we're talking about this, you know, in terms of clinical health, we're talking about someone who has such intense compulsions or obsessions that it significantly impacts their impairment in one of their areas of functioning, right? So this isn't just your friend who like really likes to have the labels all facing the same way in the refrigerator or likes to color code things. This is talking about someone who they cannot make it to their job because they are turning their light switches on 22 times, and it has to be done 22 times. They have to open their car door 22 times, and so they're repeatedly late. People may want to disengage from relationships with them because they can't handle some of the compulsions that someone might be exhibiting. So when we talk about OCD, we're talking about something that's really having significant distress. Some of these anxieties, I think in general, have become a little bit buzzwords. So it's really important to understand kind of like the clinical level we're talking about. In addition, we have panic disorders. Again, we have a lot of people who feel like they are having a panic attack, right? It is a lot more common than you would imagine. There are people that they have to pull over if they're driving. They can't make it through necessarily the work day because the panic, their heart racing, actually physiologically sweating, palms sweating. They can feel their heart rate go incredibly fast. Their breath becomes really shallow. So panic disorders, you are really seeing significant distress. Sometimes when we talk about separation anxiety, we tend to see that sometimes with younger children, especially post-pandemic, with kids being home a lot more with the parents and the parents being home a lot more because maybe their place of business was closed or they're able to work from home. We see a lot higher rates of separation anxiety amongst children and adolescents because there is comfort oftentimes in home, in their little space in their room. So we are seeing a lot more separation anxiety, difficulty separating from parents. And then there's all sorts of phobias. You probably have heard of like arachnophobia and different kinds of agoraphobia that they're out there. So when we're talking about anxiety, again, you know, we're not talking about a little bit of stress. We're talking about some really significant mental health disorders. Some of the signs and symptoms, I just talked about: constant worry, edginess, nervousness, jumpiness, agitation. A lot of kids experience headaches and stomach aches, a lot of adults as well. So I'm sure everyone's had that experience where their stomach gets a little queasy before they have a big presentation or before they have an interview or before they're meeting someone that's really important to their significant other. All of that is really normal. Again, we're kind of talking about stomach aches that happen all the time, even without reason necessarily, or obvious reason, I should say. Again, kind of talking about our younger population, a lot of times we'll see reluctance or refusal to go to school because of anxiety. Even more younger kids, you know, toddlers even can display tantrums and crying. And you might be thinking, how can I tell the difference? But a trained professional will hopefully be able to kind of suss that out with you. You might see meltdowns before, after school about things that are seemingly non-important, such as clothing, hair, shoes. A lot of times kids will have difficulties with transitions, whether it be between environments or activities, difficulty settling down for bed. And a lot of times people don't think about it, but perfectionism is typically a sign of anxiety. I work with a lot of kids who really have become wanting that kind of control over their environment and really wanting to have things be perfect and within their control. So if you do notice that in someone, that could be anxiety. So when talking about the difference between clinical anxiety and stress, everyone has some level of normal anxiety, right? It's very short term. It's usually related to a specific stressor, and it's usually resolved in a short amount of time. But anxiety disorder isn't something that really goes away, and it does persist over time. So it's more of an internal stressor than it is necessarily an external threat. So it's a persistent feeling of dread of a situations that might not even be threatening to someone. And again, this anxiety can persist even after the concern or the situation has passed. So when we're thinking about someone who's clinically anxious or who's going to receive potentially an anxiety disorder diagnosis, their anxiety is sometimes, it's a response to a situation or problem that might be, you might think, this is way out of proportion than what I would typically expect. It might feel very unrealistic for you. Like, why do you have this anxiety? There's no reason to have this anxiety. This person might be worrying about a plane crash and they have never flown in a plane. There's no plans to fly in a plane. But the person is persistently anxious about plane crashes. And it can last a very, very long time. So it's something to know that, again, anxiety is not just, clinical anxiety is not just in relation to a small stressor or even a large stressor. You would typically be anxious, right? Let's say you lost a job, or your child is struggling in school, or just your boss is giving you a really hard time. All of those things are very typical to feel anxious about and to feel stressed about. But clinical anxiety is something a little bit larger than that. And a lot of people who are anxious, you'll notice that they tend to avoid situations that they think could possibly trigger any kind of anxiety symptoms. Okay, so going into depression. When we're looking at clinical depression, we're looking at several different symptoms. And if you are coming into a mental health professional, they all have training in understanding what is the clinical criteria and symptoms that we're looking for to really be diagnosed with depression. So some of those criteria are listed here. And what is not surprising, I don't think, to anyone, but we can see kids at a very young elementary age diagnosed with clinical depression. Again, this pandemic has really wreaked havoc, not just on parents, but on children as well. Their worlds were really turned upside down. Despite how much we feel like we can hide it, they do feel the impacts of stressors that we might have as a result of the pandemic. So these are really some symptoms to kind of be on the lookout for. If you, again, are either identifying with some of these or know someone who may exhibit a couple of these, don't worry, it doesn't necessarily mean that they are clinically depressed, but it's something to kind of be aware of. Again, just start that awareness and see if maybe they would want to be evaluated or want to have an intake to see if it's something that they could use support with. Okay, so when we're talking about depression, we are talking about 5 or more symptoms. So again, this is not something where it's just someone's feeling a little low. And we're talking about 5 or more symptoms over the same 2-week period. where usually at least one of the symptoms is either a depressed mood or a low mood or a loss of interest or pleasure. And this depressed mood isn't something, again, that is in relation to a typical stressor. It's a depressed mood that is most of the day, nearly every day. A lot of people experience diminished interest in things that brought them joy. You almost feel like you can't find that motivation to do something that you would normally enjoy. You might experience significant weight loss or weight gain. And even though that your appetite might have increased nearly every day or decreased every day. Sometimes when people are feeling depressed, they feel like they are slowing down their thoughts, or they have a reduction in physical movement. They feel lethargic. And a lot of times this is usually noticeable by other people. It's not just normally how you feel like you're feeling. You might have someone say, hey, like, I noticed you're kind of down, or you're not yourself. This is the kind of depression it would be very noticeable. You would feel very fatigued. I don't know a person these days that does not feel fatigued. But this fatigue feels kind of like a loss of energy nearly every day. It's not something where you can get a great night's sleep and kind of feel refreshed the next day. It's a constant feeling of fatigue. Oftentimes, again, this is speaking a lot to some of our teens and young adults. There's a lot of feelings of worthlessness, excessive or inappropriate guilt. These people would be better off without me. I'm no good. I'll never amount to anything. This person isn't proud of me. I don't do anything right. No one would miss me. All of these feelings of worthlessness are really important to kind of notice. We also think about, we talked about this diminished ability to think, concentrate, make decisions. It feels impossible for people with this depression to make decisions. It's just too overwhelming to make decisions at times. And when we think about depression, of course, we also think of people that have recurrent thoughts of death, recurrent suicidal ideation. Sometimes they could have a specific plan. They could have had a past attempt, or they could not have any plan at all, and it's just kind of passive thoughts. So when we are thinking about this, again, some of these symptoms feel like, oh man, I really know someone who has a couple of these symptoms. If it's something you're concerned about, by all means, feel free to say, hey, like, maybe we should try and talk to someone about this. Particularly when it comes to suicidal ideation, we have trained professionals who are skilled in being able to determine whether or not someone is at risk to themselves or others. So we go through several different screeners to figure out whether or not someone, despite having some suicidal thoughts, can be safe in their own home. So just in case you do know someone with suicidal thoughts, it doesn't necessarily mean that they can't be safe or that they need to be hospitalized. It can mean that at times, but generally speaking, it does mean that they probably should be assessed. And I do like to also kind of share for people, especially when it comes to depression, it isn't always obvious. Some of these symptoms that we're talking about, right, there's some things that you might think that's a pretty obvious depressed person. I also like to let people know that there are people out there that don't necessarily display all of the obvious symptoms of depression that we have when we're talking about clinical depression. So always get to check in on your people, make sure people are really doing okay. It never hurts to ask a friend or to make an outreach and say, hey, I'm thinking about you. I really care about you. You really never know what that statement might do for someone. Looking at some other signs and symptoms, we're going to be looking at withdrawal, I think, as we talked to from either people or things. Again, if you're just a little bit low, it's not unusual for people to withdraw from people, to say, I really don't feel like hanging out. But if you know that someone who is super social just never wants to go out anymore, that may or may not be a sign that they are feeling depressed. For a lot of our teens, we see a lack of self-esteem. We see an extreme sensitivity to rejection or failure. I'm sure you might be thinking of some people who they might maybe make a mistake, might make a misstep, but they take it as, I'm a horrible person. I can't believe I did that. I failed. I'm no good. So some of this extreme sensitivity to rejection or failure. Why did I try in the first place? So we see that a lot in depression, and particularly in teens, especially in males. Sometimes for depression symptoms, it might be more short temper. It might be more irritable. It might be always picking a fight. You might see extreme tiredness, sometimes memory loss, especially if you find someone who has a difficult time initiating or maintaining friendships, social relationships. That could be a sign that that person is depressed. And then, of course, like we talked about, the more obvious, crying uncontrollably, reduced weight, that can be some more obvious signs of depression. And just so you know, like I like to reiterate, it's also important to note that not all depressed teens or individuals show these symptoms. I don't know if any of you have recently seen any social media videos, but sometimes I'll see those videos where someone will post something and say, this is a picture, this is a video of when I was at my lowest and nobody knew. And that person's often smiling, they're doing something that seems like they're surrounded by people. So again, it's always good to just check in on your friends, make those outreaches, for people in your community, maybe that don't have as many social supports as you might think, when we're going and talking about this. Again, talking about the difference between clinical depression and sadness. You might know someone, again, who's feeling down, who's feeling blue, who's going through a hard time. And oftentimes that person will say that they feel depressed. But a lot of times that feeling goes away on its own. It doesn't stay, it doesn't impact their life. They're still able to go to work. They're still able to function in their relationships. So if that's the case, someone is struggling, but they may not be struggling with clinical depression. So depression is a little bit more, it can come up for quote unquote, no reason. I think that can be the thing that is the most distressing a lot of times, again, to parents, is I often get asked, what do they have to be depressed about? They are well fed, they are well clothed, they have everything that they need. They have not a worry in the world, and yet they're saying they're depressed. And really and truly, depression can come up for no reason at all. It's not really anyone's fault. There's a lot of factors, again, that impact health outcomes and mental health. So sometimes there isn't always an easily identified reason. It usually lasts more than 2 weeks, and it does really impact your life. Certainly, some of the clients that we work with will come in preemptively and say, I'm noticing these things, and say, I don't want this to get to the point where it's impacting my life. Is there some way I can get some support now? All the way to the other end of the spectrum, where someone is like, I really, really need help now. And it's really, really severe. So certainly if you or a loved one can be preventative and can take services that might help you from getting to that farther end of the spectrum, I always encourage people to do that. There's no shame in getting help for anxiety or depression, even if you're thinking to yourself, I have no reason, I don't deserve necessarily, it's silly. But really, when I tell you it's important, and it's important for everyone. Even most therapists have their own therapists, because we're all going through things. So doing that preventative mental health stuff can really, really save you in the long run. Okay. All right. So we are going to go. Why did it stop working? Okay. That's odd. I'm gonna go down here. There we go. If you are in crisis, I just want to leave this up for a couple minutes. You can always call 911, or for children under 18, you can call 211. That's our mental health emergency mobile crisis line. Or of course, you can always go to the nearest emergency room. Those are always options to people. I often have people ask me, what do I do if it's either after business hours or I can't get a hold of anyone? If you're truly in a situation where you are either yourself feeling like you're in a crisis and you need help now, please, by all means, call 911, go to emergency room. Even if it's not something where you have to stay there, if in that moment you need someone to help you through a crisis, there is no shame in that whatsoever. Additionally, here you'll see some national suicide prevention lines. There's text line. There are live chats for our LGBTQIA youth. There is a hotline specific to them, as well as the Veterans Crisis Line. We also have a Connecticut Alliance to End Sexual Violence hotline. So I'm just going to leave this up here for a couple seconds, just so you can feel free to jot anything down. When we're talking about statistics, particularly for our LGBTQIA youth, the prevalence of either suicidal ideation or suicide attempts are a lot higher than the general population. So it's something to just kind of keep in mind. These are always good numbers to have on hand. And there's a lot of fear and there's a lot of shame, I think, when it comes to people who are, experiencing this level of depression or anxiety. It's not something easy for people to talk about. Oftentimes, the therapists are the first people that they really tell that this is what's going on with me, because they are so fearful of maybe letting people down. There is a lot of shame of feeling like you don't deserve to be depressed or you don't deserve help. So there can also be religious or cultural factors that prevent people from accessing help kind of in a timely manner. So again, please take down these numbers, some of these resources, so that you have them. Okay. All right, this is just a quick video of myths about mental health. Hopefully everyone can hear it. Oh my goodness.
Yeah, there is no audio, Melissa.
In here.
There's no audio? Oh, okay.
No.
All right. Apologies.
You could do it over.
I'm glad that I stopped to look in the chat. Okay, so you know what? In the effort of time, we are going to kind of go past this video, but essentially it's saying that if you think, sometimes there are myths about people who struggle with mental illness, such as that they can't hold a job. That's not at all the case. People with mental illness absolutely can engage in the same activities, hold the same relationships, and have the same jobs that anyone else. There's several myths out there about people with mental health diagnoses being more violent, which could not be farther from the truth. Oftentimes the statistics show that someone with a mental health diagnosis are actually oftentimes more the victims of a violent crime than perpetrators of violent crime. So make sure, I think everybody hears these kind of talking points about mental health or have these preconceived notions about mental health. But really and truly, I think many people struggle with their mental health and will struggle with it in their lifetime. So it's really important to access health. Okay, so we're going to move on. A real quick study, if you've ever heard of ACEs study, it is often referred to as kind of the most important study that you've never heard of. A lot of people have heard of it at this point. We're talking about adverse childhood experiences. In the first two boxes, they did this giant study, Kaiser Permanente, which was a health maintenance organization. They took a sample of about 17,000 patients. And just to note that this was probably from a middle to upper class population that had health insurance. I think the median age was around 57 years old. And they asked them to score themselves on these adverse childhood experiences from the first two boxes. And, if they said yes to one of them, that was their score. So if they said yes to all of them, they would have a score of 10, and so on and so forth. And what they found was they were surprised to find that at least 64% of participants endorsed having at least one ACE. And then they noticed that about 12.5% had at least 4 or more ACEs. And unsurprisingly, those individuals that had 4 or more ACEs had, of course, a much lower proponent of health outcomes. So they had more likely to have serious disease, they're more likely to have mental health issues, substance use issues, engage in riskier sexual behaviors. And to them, that was shocking. I think to us, that is not shocking whatsoever. Take a second right now to kind of just calculate what your ACEs score might be for yourself. You don't have to share it with anyone, but it is something to think about for yourself, an adverse childhood experience. We also have some newer thinking, and the newest thinking about the ACEs research is the ACEs plus box. So of course we can't talk about trauma, and we can't talk about depression or anxiety in our communities without acknowledging issues like racism, which obviously can be a greater impact on people of color. So trauma-informed care goes hand in hand with equity and multicultural issues. And really to have a true understanding of adversity, we have to have an awareness of the impact on systemic racism, all the isms, homophobia, sexism, poverty. There's many subtle and not so subtle discriminations or chronic stressors that accumulate over time. We think of it as kind of like a general wear and tear on the body. So when you're thinking about this, think about some of the things that you experience. We'll talk a little bit about, I know it can be a little overwhelming to think about, but we'll also talk about resilience and the things that can combat some of these adverse childhood experiences. This is a brain scan of a client, an individual who was suffering with significant depression. As you can see, there is less brain activity. All of this part here that is kind of lit up is someone who does not have clinical depression, where here you'll see a lot more areas of the brain that aren't engaged. They actually have some neuroimaging of kids that were in a Romanian orphanage or that were diagnosed with PTSD, and the brains were actually 7 to 8% smaller. So we know that trauma and depression, it is not just something that is happening kind of in your mind. It's something that actually impacts the body physiologically. The good news is the brain can adapt and heal. And this is my absolute favorite part. When we're talking about therapy and we're talking about services, a lot of times people think, what can talking do. It can't change my situation. It can't change the way that I'm feeling. But what we know is that the brain is always adapting. It's always integrating data. So it's always integrating data with your body, with your memories, with your emotions, with the ways that you're thinking, to make more improved decisions and autonomy over yourself. So when we're talking about, coming in for therapy or getting services, we're not just really chatting. I think we like to think of ourselves as almost like brain surgeons to a degree, where we are really building new connections, new neural pathways between just various parts of the brain. So when we're talking about services, it really isn't just chatting. It's really thinking, helping people figure out different ways to feel, think about their environment. And over time, that can really heal somebody. When we're talking about treatment, there are many different kinds of treatment. So when you're coming into Wheeler, you could expect to get an intake, and someone might make a recommendation for treatment, based on what you're talking about. So there is, of course, psychotherapy or talk therapy. That's the most traditional type of therapy that you probably have heard of. And you might have even heard of different kinds of talk therapy. So you might have heard of CBT or DBT, what we think of as cognitive behavioral therapy or dialectical behavioral therapy. EMDR, these are some of the newer therapies that are coming out. And these are, treatments that can really have a huge impact on yourself or the people that your loved ones. When we think of specific kinds of talk therapy, we know that CBT has studies and evidence-based studies that it helps people change their thinking patterns that have been typically harmful or ineffective. And that it's specifically really helpful for people who struggle with anxiety, depression, and trauma, as well as eating disorders. I believe you had Melissa Mendez last week, and she might have been talking about this as well. DBT is another therapy that we know that helps with chronic suicidal thoughts, clients who have what's called borderline personality disorder or PTSD. We also have EMDR, which is called an eye movement desensitization and reprocessing. So especially those clients with PTSD or trauma. So when you're coming in, again, and you are talking, there are very specific ways in which we are talking or communicating or working on skills in those sessions that have really evidence-based practice in being able to be effective in treating those clients. There's also different levels of care that you might be recommended to. Wheeler has different levels of care within itself. It has some in-home programs that are more intensive for youth and adolescents. It has outpatient, which is typically where someone can come in bi-weekly or once a week, or maybe see a group once a week. And we also have intensive outpatient programs, which, someone might need the kind of level of care where they're coming in 3 times a week. So there's varying levels of care, and there's levels of care called PHP, which we don't have, but it's a partial hospitalization program or someone that needs an even higher level of support. So of course, there's inpatient beds as well. And so when you do come in for an assessment, someone is trying to take what you're saying and really determine what the best level of care is and make a recommendation at the end of that session. There's also varying levels of testing and assessments. I do like to let people know that any therapist or agency doesn't necessarily have all the tests and all the assessments. There are certain tools that we use to try and come up and determine with what's going on for that individual. But even if we don't, typically, again, we'll try and give a recommendation at the end to say, this is the specific kind of test or the specific assessment that you might need. At least to point you in the right direction. Of course, when we're talking about treatment, primary care and physical health are hugely important, right? Think about that first slide with a pie. That physical health is about 30% of our overall health outcomes. And that's something that Wheeler has expanded to over the last several years. So we don't just have primary care, but in some locations we have either chiropractor, dental, OBGYN, depending on what it is. So if we are taking care of ourselves physically, it really lends to taking care of ourselves mentally as well. And then of course there's community resources, right? We cannot go without saying that the connections that people have within their community, the supports that people have within a community cannot go overlooked. And really they are the unsung heroes, because those are the communities that we have are really what ground people when they are struggling. So community resources, which you guys really know a lot about, is something that's hugely important when it even comes to treatment. All of these things help support someone who is struggling with mental health. And then of course there's medications. It's something that is a very personal choice. It's not something any therapist will push on anyone. It's something that we make available if it's something you're interested in or can give you education in if you're interested in it. Wheeler does have psychiatric APRNs and a psychiatrist if that's something that you are interested in. But again, I think if it's something where you are just starting in treatment and you know, they might say, hey, let's just talk this out. You know, we don't necessarily need to jump to that route, even if it's something you're thinking about. So you'll always get a lot of information, but nothing is anything that you will be kind of pushed into taking. But it's good to have all of that information. I'd like to just touch on real quick the difference in providers. This is something I find a lot of people find very confusing, understandably so. There's a lot of different providers that you can come in contact with. So psychiatrists and APRNs, I like to let people know those individuals tend to be more medication based. So when they're listening to what's going on, they're thinking about what medications can target those specific symptoms that have the evidence or research to support that they do help with those symptoms. Whereas a psychotherapist, so we're talking about your LCSWs, your LPCs, LMFTs like myself, we do not have the authority to write a script for medication. We are the ones doing that kind of CBT talk therapy, recommending you to particular levels of care, working with families on a daily, weekly basis or in group settings, but we do not prescribe medications ourselves. And then when we're talking about PCP or primary care, of course, those providers are typically just addressing your physical health needs, although in many of our health centers, we also, the PCPs work hand in hand with a behavioral health consultant, so that if you do note something in your physical, they can connect you with someone that has behavioral health training as well. A lot of times people too will come in asking specifically for a psychologist. We don't have as many of those on staff, but psychologists are great. They tend to be a little bit more research based, but we all kind of have the same goal, right? Our goal when it comes to working with clients is making sure that we can improve your overall level of functioning and address whatever issues you're coming in for. So all of our areas might differ a little bit. The goal really for the client is really to make sure that they are well supported. We also have peer counselors counselors typically aren't licensed professionals, but they have sometimes lived experience. They could potentially be in recovery themselves from substance use or a mental health disorder, and have specific training in how to help other people kind of come out of where they themselves have been. And right on time here, generally speaking, if you or a loved one, is struggling with mental health or depression or anxiety, here are some ways to kind of get started with treatment. We do have open access hours, particularly at our Hartford location between 9 and 3 o'clock. I do let people know that if they're coming in open access, that sometimes they can expect to wait. We're doing our best to get to everybody. We also like to let people know that sometimes an assessment or an intake can take up to approximately 60 minutes. So sometimes you don't have time to wait that much. So that's something important to know. Open access, it doesn't guarantee to be seen same day. However, we do have a special partnership and relationship with West Indian Social Club. And so because of that special partnership that we have, we do have an individual whose name is Caitlin Keller. She's one of our peer specialists. Her number is listed below. If you are, or you can also connect with Chev as well, to say, hey, I'm really interested in potentially going into Wheeler. Can you help connect me? Because of that partnership, we can schedule you an intake so that you have a specific day and time that you can come in, where you will not have to wait. That's something that we don't typically do. We don't typically schedule intakes, but because of this relationship, we really want to foster a trust in the community that they know that if they're in need and they have a crisis going on, that we can help them. And that, again, it's typically between the hours of 9 to 3:30 that we would schedule something, but just keep that in mind as something, for yourself, again, or others. There's never any harm, even if you did come in for a service and you just decided it wasn't for you. There's no pressure. You don't have to do anything that you don't want to do. Even if you just want to find out more information, that's absolutely fine. And that is all I have for you for that. Okay, the screen sharing has stopped. Does anyone have any questions? I know we're kind of going over. If you have questions and you don't want to necessarily take anyone's time, please feel free to reach out to myself, as I'm happy to answer anything.
Okay, thanks, Melissa, for your presentation. It was really timely and very interesting. I don't see a question in the chat. Does anyone have a question they want to ask by unmuting themselves? Okay, so seeing none. Okay, so Chef put her email up there if you need to ask maybe further on, and that is, the email is health@WIS. Okay. All right. So we will then continue. A question. We'll if you have questions after, you can email us and we can get the answer to you. So thank you again, Ms. Alvarado, for that presentation. I'm thinking, what am I going to ask for the $25 gift certificate? Okay, the first person who can respond in the chat, Melissa listed in one of the first couple of slides under anxiety disorder. She listed a couple of diagnoses. So if you can name 2 of them that were listed. That's, well, 2 together. So I saw 1. Okay. Okay. It looks like the person who did both was Daniela, who listed OCD and panic disorder. We'll take it. It was you were typing very fast. All right, so Daniela is the winner. We will get your contact information to get to you the $25 gift certificate. Congratulations, Daniela. All right, I don't see any other questions in the chat. So I think we're done. Our next session is on July 28th, 7 p.m. on Zoom, and that topic is attention deficit hyperactivity disorder and autism, and the speaker is Concepcion Cortez. Same time, same place. We'll look forward to seeing you. And I still don't see a question in the chat. So again, thank you, Melissa, for coming on board. Great presentation. If we have questions, we'll reach out to you and we'll get the information to the folks if they have questions after that.
Thanks so much for having me, and thanks everyone for joining tonight.
Thank you.
Guys, before you go, I'd just like to just wrap everything up. I want to thank you, Dr. Rule, for moderating this program once again. Melissa, thank you. You did a great job. You were informative and you gave a lot of information that we can use. And to the audience, I just want to thank you again for showing up. I know there are so many things you could have done and you showed up and I appreciate it. Just to let you know, for those who are local in the community, the idea is to bring these services to you. So if you know anyone, or if you yourself need access to resources that Melissa talked about, or anything that's offered at the Wheeler Clinic, please feel free to reach out. I put the information for Wheeler Clinic in the chat, and I think Shav, our program director, had put the West Indian Social Club information. Melissa, if you can want to put up your direct number, you could probably do that as well. People could identify with you and probably reach out to Wheeler Clinic saying that they heard your presentation and they want some help. You know, in our community, we have this stigma about mental illness, and we're trying to dispel that stigma to just make sure that everyone realizes that mental illness is just as important as physical. Mental wellness is just as important as physical wellness. So again, thank you guys. Thank you for your time, and we hope to see you next month. Thanks,
Thank
Chef.
you.
Good
Thank
job,
you.
everyone. Thank you. Good night.
Good
Thank
night.
you. Congratulations, Daniela.
Yeah, Daniela. Oh, before Daniela leaves, I have to, I have your information, so I will send it to you. You want a $25 gift card, and it could come in handy for whatever. So thanks again for joining us, and thanks for everything, guys. It was great.
Good night.
Thank you.
Thank you.
night.
Good night.
Good night.